What's going on, everyone? Welcome to the Healthcare Hustle Podcast. Today, we are joined by Takisha Lovelace, Vice President and Chief Operating Officer at Affinia Healthcare. Takisha, welcome to the show.
Thank you for having me today. Thank you for having me.
Yeah, we're really excited to have you, Takisha. Thank you so much. If you could, we'd like to start off with your journey through healthcare and through leadership. If you could share with us and the audience just a little bit about yourself, that would be great.
Sure. So my initial segue into healthcare, I kind of started in a different way than most. I didn't initially start within healthcare within my career. My career started within IT. I was My first real job was within the military. I was active duty Air Force, and my job was within the IT field. And that is where I thought that I would continue within, my adult career within my career. So I came out of the military, discharged from the Air Force, and came here to St. Louis. And I had my first job with AT&T downtown, and I worked in the network administration and um, project management, and that is where I felt that my career would just continue to grow from there. But I soon found that it was a little different in that each year we would talk about rifts and job reductions, and that's just how it was within tech. But also keeping in mind too that this was the early 2000s, jobs were abundant within tech. So yeah, you would lose a job, but you could also, find yourself in another large organization. But I just, I didn't want to do that. And I think around 2009, I just had my son the year prior, and I was one of those people that was laid off. And so they gave us, I believe they gave us 3 to 4 months to either find a new position within the company or to look elsewhere. And so that's kind of what I did. I started out looking for other jobs within AT&T, but then things just weren't happening. It was so many different people with different within different groups who were being transitioned out. So the jobs were not abundant. So, and around that time too was also a lot of, chaos within, just the world period. So I talked to a career transition coach, and they mentioned my military status, my veteran status, and how I could possibly look into positions within the federal government. I'm like, okay, so that's something. My parents have really kind of instilled in us a sense of finding a career that had longevity and stability. So I didn't really take their same path, but that foundation was already set. Longevity and stability. So what career fields could I go into that, I did not foresee going away, and that was healthcare. So I started looking within the VA. So I found a template on how to put together a federal resume, which was, a little different than your typical resume, and start applying. What can I do? I had no experience within healthcare at all, but I did have skills and I did know what I was good at. So try to parlay, how can I transition and parlay some of these skill sets that I have within IT that could transition over into healthcare. I knew I was a problem solver. I enjoyed problem solving complex issues. I could learn quickly. Um, so different elements that I was able to put into the resume, projects, et cetera, that I've done within the military and also within my work within AT&T. And I waited. 2 3 months went by, didn't realize it took so long to get into the federal government, but it does. And in talking to other people in hindsight, that was a pretty quick transition, honestly. And so 2 or 3 months went by, I received notification that they wanted to interview me at Jefferson Barracks in the pain clinic. So went in, did my interview. Uh, Thought I did well. Couldn't really answer some of the questions, but I, let them know that this is what I was looking at. I wanted to transition out of this particular field into healthcare. I'm willing to work. I'm willing to learn. I'm willing to do what needed to be done. And I was hired as a program manager within the pain center. Well, now it's a pain center of excellence, but then it was just a pain clinic underneath the spinal cord injury service. And so spinal cord is a large injury, a large unit within the VA. They had a subset for pain where our veteran patients would come in who were prescribed opioids, and we had different programs set in place for them to either, kind of wean them off of the opioids or give them an alternative around other things that they could use for pain. Like, we had chiropractic, we had physical therapy, we had a pain psychologist, and it was really kind of an upstart. And so that was where my foundation started within healthcare, and that began, the work in terms of where my career started. So learned everything from scratch there. I really appreciate how they saw something in me, and we were able to kind of build from there. I knew nothing about accreditation sources like with CARF. Just went to Chicago and learned about that and how, what needs to be done in order to, the goal was to be the first CARF accredited pain clinic within the VA system. And we were able to accomplish that. So, just really learning and growing and making certain that the things that I did not know, because I was the only non-clinical person on the team, that I did find out the information. And so that was part of the virtues that I have was, again, being a self-starter, being able to learn quickly, being able to find information for myself. And so those were my strengths, and I was able to really, really thrive within that environment. So that's kind of where I started, and just kind of progressed from there.
Wow. I number one, just thank you for sharing just your origins. And I get energized because, oftentimes these conversations are motivating and inspirational for us. And so it's just amazing. And we're going to get into it because you had a vast amount of experience, I feel like, in the healthcare industry since you started in so many different settings. But I think, to my knowledge, you may be the first guest that we've had that has served. In particular. So can you just, kind of going back to your time in the Air Force, could you kind of speak to maybe how that, kind of shaped maybe your style or some of the, as a leader, and just some of the experiences that you took from that? And did that make the transition into the VA a little bit easier because you were more knowledgeable about some of the things that were going on?
Yeah, definitely. So as far as that time within the VA, well, I'll start in terms of just some of the things that I took from my time while in military service. So, I think that time within my life were part of my formative years, within my 20s, really coming out of school and not really having a full idea of what I wanted to do in terms of my life. But I knew I wanted to learn something new, which was within IT, and I wanted to travel, and I did that. And I wanted to see the world, and I wanted to it was just different things that I wanted within my life, and I was able to accomplish those things. So those were some formative years for me, and really kind of shaped who I am to the core. So for one thing, my military service gave me a sense of what the importance of grit is. So to have passion and perseverance in the midst of adversity. So I was born and raised in Nashville. So being outside of the familiar, across the world by myself, sometimes, going here, there, everywhere that they told me to go, learning a new job, all within, your career field, of course, but learning something new each place that you went. And sometimes without a lot of instructions. So navigating on my own outside of the familiar. Sometimes I didn't hear from my family for a very long while. Going into places that were just really unknown to me, unknown to my group. We all were kind of in the same situation where we were just kind of out there just winging it. So being able to, understand what the importance of grit and to have a mission in place and to know that there is a mission, this is what we're asking you to do, figure out how to do it. And yes, it's hard. And yes, you're kind of lonely at times for the familiar, but you have to do what you got to do. And so just having that mental toughness, I think, kind of really shaped me. I didn't have that before, I don't think. Also, another thing, integrity. So I remember being in basic training and they talked about integrity. That is something that, probably a lot of people knew, but it had never been brought to me in such a way that it really moved me. He mentioned, this was my training instructor, he mentioned, what is it when you do the right thing, even when no one is looking? And a lot of people, and you notice that a lot of people, they do things for show. They do things because people are looking so they can, get the accolades or what have you. And it's not really real in terms of who they are. And that stuck with me. Like, it stuck with me in a major way. And I still take that with me now. I try to give it to my kids. Like, you have to do the right thing. Do the right thing, even when no one is going to give you a pat on the back, even when no one is going to be looking at you, even if no one is going to give you the kudos and the accolades, because that's just what you're supposed to do. It's just what you're supposed to do. And I think the other thing, and most people see that military, they it's synonymous with the military, but it's discipline. And in this case, it's self-discipline. And so in take it even further, self-discipline in the professional setting. So learning, growing, moving from each duty station to duty station and learning different roles. It took a lot of self-discipline to work independently, communicating with various levels of leadership, completing assignments on time, and doing it well. And that requires time, energy, and attention, having pride in your work, getting the work done without procrastination and not needing a lot of oversight. And I think some people are still missing that. um, I don't need a lot of hand holding. And I think that that is what came from that experience in the military. Now, bringing that to the VA, it was very comfortable for me because my direct leadership, he also spent a lot of time within the active duty, but at that point, he was a physician within the reserves. So he still had that military mindset. And I think we matched so well because of those things. He knew that I could get the work done, that I did need little instruction, that he could give me, a project to do, and I will figure out how to do it, that I didn't have to be watched over, that just different elements that I was able to take from that experience. And I also believe too that they um, probably hired me because of that also, not totally, but just because they could relate to that experience. And one thing I was very surprised about it. You would think that within the VA there were a lot of people who had a military background, but the people that I worked with did not. Yeah, so that was surprising for me. And so that in a good way, because that means that you want to service these veterans on your own, not because of how you relate to it, that this is something that you're drawn to on a foundational basis. For me, I thought it was a great thing because I'm able to provide services that I, as a veteran, could also utilize. So that would make me want to give them the highest quality of service because I'm, could possibly partake in these services and resources as well.
Wow, I'm not gonna lie. That was a lot of gems, value. Honestly, seriously, because for me, it's really good to cover those foundations, those
Mhm.
values, those principles that really kind of guide us as we go through those adverse situations in the workplace.
Mhm.
So I really appreciate that. I think our listeners are gonna be able to take away a lot from that.
Thank you.
And earlier, I think during your journey, one thing really kind of stood out to me. I made a note of, which was that
Mhm.
you were the only non-clinician on your team initially,
Mhm.
correct?
Yeah.
I think a lot of us feel that same perspective on things.
Yeah.
And so I would really like to hear how that kind of factored into or how you kind of your experience, I guess, in community health, working maybe with non-traditional providers like doulas or community health workers, how that has helped you as a COO, or how you use that knowledge to your advantage.
Yeah. So, just in my role in community health. So being non-clinical and just understanding the work that needed to go forward within the various communities. Just when I think about the population that we targeted, it was large for us because this was our whole world. Like community health, this is what we focused on: those who were marginalized, the vulnerable. But in the grand scheme of the overall health system, it's very small, right? As far as the overall health system within Mercy, this group of patients, I say about 10%. So being able to take the information that I had from previous roles and knowing that, like community health workers, I didn't really work with doulas as much, but mostly within our community health worker space, just knowing the impact that they could have and how we could expand on their use. Um, I think that was important. And we really, really keyed in and honed in on those particular roles and tried to give them additional um, headway and leeway to kind of, widen the space for them to go into the clinic space and be able to take additional time with those patients, outside of the 15-minute increments that they have for their, appointment slots and whatnot. There are many different needs that could be met by those community health workers. Transportation issues. Why is a patient not showing up for their appointment? Are they having transportation issues? Do they have transportation, or is the transportation late? Can we figure out a different way? Food issues. All of those social determinants that sometimes get in the way, a lot of times get in the way of their overall health care. Can't get to the appointment on time. And then we look at those no-show rates. What does that mean? And I learned that too in the VA. We had huge no-show rates, like really, really bad. And when you really drill down on the reason why, and I know I'm kind of skipping a little bit because I'm going back and forth because, as you mentioned, I had different experiences. I moved around, but when we really drilled down on the reasons why, those were the reasons. They were transient, um, transportation issues, just caregiver issues, child care issues, like so many things. And if we had known more about the community health worker space and role then, I think we probably could have helped more. More of our veterans come in and be able to get assistance within our pain services um, because those patients that were referred to us, they could not be helped by their primary care physician. We were a specialty, so their primary care wanted us to help them to either get off the opioids or to find a better way to kind of address their pain needs. This was chronic pain. This was pain that was not going away. This was pain they were going to have to live with for the remainder of their life. And so we had to, determine some different alternatives to be able to have them to live with this pain. And that's a hard pill to swallow when you think about it, just having pain for the rest of your life. Like we typically can't even fathom that, but this is their reality. So, they're going through a lot of different things, even to just get in our doors. So how can we help them to be able to access our services?
Wow, I feel a little ignorant, honestly, listening to you because there's so many things about veterans' health that I never really thought about or really looked into.
Sorry, I'm gonna like those out.
That's all we are good.
I don't move around.
But I never really thought about it. So I'm like, oh man, we could have a whole conversation based on that. But
yes.
I do want to kind of get a little bit more specific on just all of the experience that you had. And I feel like, through your career experience, maybe you have covered every aspect of healthcare from community-based organizations. You've been a part of academic medical centers. You've been, in different just sectors that have done different things. And now, you're at Affinia. What are some of the experiences or what setting did you feel like you enjoyed the most or you maybe learned the most? And on top of that, at what point did you start to kind of look for the C-suite positions and say, okay, I'm ready to make a bigger jump in leadership?
Okay. So That's a three-part question. So the first part, which one did I enjoy the most? I think the one that I enjoyed the most, that would be my work within community health, my previous role. I loved my role. I could stay there for 20 years, honestly, because there's so much that could be done and it's ever evolving. Um, and I love my leadership, my my coworkers and whatnot. We were just constantly growing, and just the work within community health. I learned so much that I did not know, and I learned something new every single day. But the role that I think had the most impact on my career and who I am professionally is in practice management. And so that was the first time that I worked at Mercy, because I came back the second time and worked in community health. But uh, you know, that was the job that I moved from the VA to, because, and I wanted to stay within the VA. I did. But as with federal positions, VA in particular, if you are not able to move or, transition to another city or state, to another VA, sometimes you don't have that opportunity to kind of move into different GS levels. I had small children. My husband and I could not make that move. We could not move to another city or state for my job, and just kind of uproot. So I said, where am I? What are the gaps in my body of work that I need to fill? And certain things will keep coming up in interviews. And so I said, how can I address these things? And that's again part of the mindset of, the military. How can I fill these gaps? Where can I get this information from in order to make myself a more rounded and complete resume, a body of experience? And so that's when I wound up working at Mercy in practice management. And when I say that was trial by fire, listen, I learned everything. And a lot of people don't get that experience because they're not in the clinics, but I was able to see firsthand patients coming in. This was internal medicine, so your primary care doctor. You coming in for everything, from strep to, my foot hurts, whatever. So 15-minute appointments, making, physician schedules, seeing that if a patient is late coming in early in the morning, it throws the whole day off. Getting those text messages in the morning, I'm not going to be able to come in. Okay, who's going to work front office? Who's going to work back office? No show rates. I learned metrics. I learned quality. I learned patient complaints, personnel issues every day. And it was, for a while, it was, in the beginning, it was hard because I'm coming from the VA setting. And after a while, I worked there for so long, I could do it with my eyes closed. But, it was time for a change too. And that was definitely a change because I did not know a lot and I was learning. And eventually I was, I was doing my thing. I had very, very, I'm not going to say demanding, but my physicians in my practices, they wanted things a certain way. And so a lot of people thought that they were very challenging, but I just felt like, okay, they want their schedules, they want their practices to be a certain way. Again, from the military, I've seen and heard worse. Okay, so these doctors, okay, that meant nothing to me. I'm going to take care of it. Don't worry about it, and I'm going to make sure that this practice runs smooth. And I had various locations, and it's hard being in one, different places at one time and knowing that you have certain, locations that need you more than others. But receiving that experience firsthand was instrumental in who I am as a professional. I can get along with anybody. I can take on any challenge, any personnel complaint, any patient complaint. Thinking on my feet, going into the job and just thinking, okay, how am I going to shift the schedule around? Who's going to work this? I need to cross train you to work this. I need you to do this. Just coming in the door, just thinking. just strategizing, just figuring out how we're going to get things to run smoothly today on all of my locations. And so that role was able to allow me to fill those gaps that I would have never ever touched or encountered within my role within the VA. And I think it's important to, to realize that, sometimes you do have to leave and go different places. I mean, people can get comfortable, and that can sometimes turn into complacency, I think. But I'm not one of those people. So, I saw that there was some areas that I needed to address. And so I honestly, it wasn't my doing. It wasn't my intention. I thought this was just a good role to go into. But it filled all of those gaps that I needed to have filled. So I grew by leaps and bounds, honestly, just the long and short of it. Uh, don't regret working there at that time at all. Knew that I could not stay there, you know, because that's not where I wanted to be. But I knew then at that point that I wanted to go into operations. I wanted to extend into operations, and I wanted to, you know, level up in terms of my career, that I could do it. I didn't know how, but I knew that there were, that somehow it was something was going to come across. And, with my career, whenever something happened, I would try to push, press, and, make something happen. Just doesn't work out right. So, I think that I've been blessed to be able to just kind of let things fall into the next role. And they really have been great for me in terms of, my experience, and just filling the gaps of where I needed to go in terms of my career. And I kind of found myself here. And it hasn't been a hard transition. Of course, I'm still learning, right? I'm going on 3 months now. So I'm not saying I know everything, but I think that everything that I had to go through led me to this point, is what I'm saying.
Just thank you so much. And just to follow up on that, I love, number one, just the different perspectives, because we actually recently had, an executive that was on the show that had stayed at their organization their entire career, right? And so I think you
Yeah, that
mentioned,
happens for some people.
and it does, but I think you mentioned a lot of good things, particularly, for folks like Brandon and I as young professionals. Sometimes we kind of, the first entry level position, we're already thinking about, what we're
Yeah,
going to be doing right before retirement, right?
yeah.
And so just a quick follow-up, were you strategic kind of in the amount of time that you were going to spend at each organization till it got you to a certain point? Or did you kind of have like okay, I'm going to go here, I'm going to accomplish this, I'm going to learn this, and then it's going to be time for me to move on? Did you know that as you were moving up the career ladder?
Initially, no, because I was at the VA for 7 years. When I say comfortable, I was comfortable. And honestly, I probably could still be there now if I was able to get to the next level of what I was, interviewing for. Because it was great for me. I knew everything, I knew everybody, and I had no issues. But I think after talking to various mentors, and going to different networking events, and just hearing different people, and they were saying that you should not stay within your same role within X amount of years. And I was looking at my, just the time that I've been there. I'm like, I can see that. I can see how people are, strategic and intentional about how long they plan to be somewhere. Um, so, from that point, working in, in the practices, I was like, I'm going to give this X amount of time to really get what I need out of this role. And I think that's kind of where my attitude was going forward. I will say this though, my previous role at Mercy in community health, I just felt like I could honestly retire there. I love that job, but this role was a dream role for me. This is what I wanted. When you say you write down your aspirations, and I learned this in SLBDI, St. Louis Business Diversity Initiative, and they was talking about your your personal board of directors and where you foresee yourself. This is the role that I wanted. I wanted to be in a C-suite role in community health, in, possibly in FQHC. At that time, I wasn't even, like, I want to be amongst my community. I want to see an impact. And I was blessed to be able to be afforded that opportunity now. I'm nowhere near ready to retire. Okay. That's kind of where I saw myself later down the line. And it's funny how you can say, well, this is where I want to be. Like you said, what's leading up to the role before I retire? I'm not ready to retire. So I don't even know what's next. Like, I don't even, it's like, I'm here, I'm loving it, and I'm just willing to learn and grow. And honestly, when people ask, okay, so what's next? I don't even know. I just got here. you know. So, so to answer your question, yes, after I wound up transitioning from my job at the VA, I was a little, strategic in terms of how long I stay. Um, Considering too, and I'm just going to be a little honest, I felt as if I came in a little later in the game than other professionals because of my time within the military. So a lot of people just started right out of college. I did not. I had a military career and a whole other separate career in another industry. So I'm like, I'm behind the eight ball. Like, I'm like, people younger than me are, doing these things and, excelling, and, I'm trying to make up for lost time. But I have to look at everybody's individual journey as well. Like I look at someone else's role. I can't get to that same role in that same path. I can't. Everybody has their own path, and there's no one way to get there. And I learned that as well. Because I can't mimic your steps. I got to make my own steps. And that's just how things have happened for me thus far. It hasn't been the typical, it has not been the typical way at all. So I'm sure you can see that from my resume, but it all works. It all works together. So.
Thank you so much, Takisha, for that. You really are kind of, just blessing our audience with a lot of gems. And one of the things that kind of stood out to me was in regards to like how you address those knowledge gaps and how you kind of, took it upon yourself to just go through that crucible and just kind of just take it on. Didn't know what you were doing, but you still said to yourself, I'm going to make it work anyways. And, right. And I'm sure that your time with the Air Force really helped you as far as dealing with that adversity piece and just kind of being able to maneuver well. And one of the things I do like to take advantage of is you are seriously a wealth of knowledge, right? So you have a lot of expertise under your belt. And I think in regards to primary care, you said you were kind of working with a lot of the internal medicine physicians. And so I guess as you see it, can you kind of talk to us and our listeners about what the primary care space looks like, or what that exactly is or entails?
What it looks like now, or what it is going towards?
I would love to hear both, honestly. If we could talk about maybe what happened in previous times and what we're kind of moving towards in the future.
So, just from my frame of reference or my experience, what it looked like before was more physician-centric. It's centered around the needs of the physician. In terms of scheduling, 15-minute slides, I'll go back to that. That's not really helpful to a patient who has a lot of different needs that they are coming in for. And they have to kind of narrow down. So after the MA comes in and does everything they need to do and reconcile your medications and ask you, exactly what you're here for, how much time do you have left really to speak to your doctor about this one issue that you got to get out, because you can't get 2 or 3 things out, and if you're late, then, get it, if you have, a late show policy or whatnot, if you are after a certain amount of time, you may not even get a chance to even see your doctor because of this policy in place. Or if you do, they'll get you in, but you have very limited time. So basically what I'm saying is it was more physician-centered. What I do foresee, and here at Affinia, we within the primary care space is addressing the needs of more being more patient centered. So addressing the needs of special patient populations like our LGBTQ plus communities, immigrant and refugee communities, senior and elderly patients. These are patients that are sometimes kind of not really addressed. They have special needs sometimes. We talk about our immigrant patients. There are a lot of different needs that they have when they come into this country, plus the language barrier. What does that look like? Do we have interpretive services for them to be able to, state what's going on with them? Do they feel comfortable? You're already in a new place. So, you have health needs, you have social needs. How can we address those needs? So that is what I see us going more towards. And those are the things that we are here at our organization addressing, because that's kind of the future state of healthcare. The various um, patient populations. We talk about underrepresented. I think they qualify as underrepresented. Our Medicare patients, again, senior and elderly, and there's a lot of seniors that are aging in place, and they still need assistance because they are getting older and they're living alone and they're living in their home outside of facilities. So addressing the needs that they have in order to extend their long life with longevity and vibrancy, and making certain they have the resources that they need in order to be able to continue to age in place. Addressing the needs of our nursing shortage. What's happening with this? We're not having enough nurses coming through the pipeline. Physician burnout, addressing that. What does that look like? So, taking that into account, seeing patients by phone and video conference, does that assist our patients? I mean, our physicians in their burnout rates, making certain they have everything they need as well. And then we look at the public health emergency ending, and within a couple of months from now, and what is that going to look like for those patients who no longer are insured? The rush of uninsured patients that could possibly come in through our doors. So just remaining agile, being able to have flexibility, to be able to hear what the patients need, hear from them, and actually do something with that information. So what does that look like? How do they choose to access us? Being proactive versus reactive, reaching out to our patients and ensuring continuity with those patients, not letting them fall through the cracks. So that's kind of what I see in terms of primary care.
Wow, I thank you for those insights. And I love the point about, it initially being more physician-centered back in the day, shifting to, a patient-centered focus. And I was actually kind of blown away by the work at Affinia because I wasn't as knowledgeable. And I was like, oh, wow, I didn't know that there were organizations that specifically focused on primary care services, and not just like a standalone, physician's office or something like that. So it just started getting me to think, kind of to piggyback on Brandon's question, so we represent St. Louis, all work in St. Louis. We know that there are, some unfortunate, unprecedented, inequities within St. Louis. So can you speak, a little bit more about the inequity or the equity piece, I guess, that you see in primary care? So I'm just thinking, for example, when it comes to, if we're looking at racial or ethnic categories, I believe, at least in the city of St. Louis and county, Black folks may be, less likely to have a primary care physician, right, than their counterparts. So how do you kind of, see Affinia addressing that, filling those gaps? And just from your perspective, if you had to speak on the inequities within the primary care space, what would some of those things look like?
Speaking on the inequities within the primary care space, you mentioned, not having a primary care physician in place, or not having access. So, here within our organization, our biggest mission is to address the needs of those who are in vulnerable spaces, so those who are underrepresented. And we have a history of advocacy within our city. So we're embedded in our communities, and we have a foundation of trust and equity, and we strive to be a safe and affirming healthcare space for anyone, along with providing quality, patient focused, as I mentioned, affordable healthcare. So, in order to provide equity and quality, again, we talk about seeing those various special patient populations that we really want to focus in on. Another thing we really are looking at is maternal health. That's a huge thing right now, and about kind of extend postpartum depression, things of that nature, eliminating barriers in that space. So women's health, Medicaid expansion, maternal mental health, and again, one of the things that we're really focusing on, postpartum Medicaid coverage. I think that's in inequity. So the Missouri legislature is, hold on one second, gotta blow my nose. So, we talked about how, within Medicaid currently ends within 60 days after birth. Okay, but it's been documented that women pass away or have, a lot of complications within that first year. And so what we're asking for is for Medicaid extension until, 1 year. Lots of different reasons why they have complications. Of course, we talk about, postpartum depression, but it could be, hypertension, heart conditions, anything. Childbirth is very hard on a woman as far as their bodies are concerned. So not having coverage after that 60-day period is, it's tremendous. And it is an inequity, right? Because if you don't have coverage and you don't qualify from that point to have coverage, how are you able to see a physician for anything that you need from day 61 on up? And that's how women, fall through the cracks with these complications and sometimes death. So, having this extension has a tremendous potential to save lives and make a meaningful difference in not only to the mothers, but to their families. Because when, children are losing their mothers, especially newborn babies, it's just, it's a hardship, right? So, being able to have that additional coverage for full Medicaid benefits up into that year, and that coverage includes, dental. Let me tell you, here at Affinia, our dental team, they are working. And the thing is that I learned, I think sometimes we take these things for granted. Dental care is not a luxury. It is not. So to be able to go into the dentist and get work taken care of, or even a cleaning, that's not something that should be an option. Like, you need to have it, even, from a child up, you need to have dental care. It impacts so many different things, heart, even preterm birth. Yes, having that coverage is essential. So, in behavioral health, vision, just to be able to go and see your doctor within that time frame. So that, when I think about inequity, I think about that, and I think about those women who may not have coverage anymore. They had it throughout their pregnancy. They have it 2 months after their child is born, and then they're cut off. Right. So, that's something that we're really, really pushing for within those who can advocate on a higher level. It's those who have the responsibility to make these changes, and they don't even work in this space. That's a hard thing. So we go through what we need to go to Jeff City and talk to those and advocate and, make our voices heard to those who make those decisions, who impact us and impact our patient populations.
Wow. So number one, I appreciate you. I think being a COO, I think so many times, from what we've heard, the people we've interviewed, obviously so much is focused on the operations and the business.
Yeah.
But, I just had to give you your kudos for being able to just obviously speak to the things that would get our listeners really energized. And it really sounds like from the primary care vantage point, it actually gives you the ability to be a little bit more holistic with
Yes,
the patient population that you're serving. Because I'm just
that is
thinking
the
like,
goal.
I don't know if I would hear this from someone who works at a large hospital where it's inpatient focused and
Right.
so many things are crazy. And so and we talked about this a little bit. Do you see primary care being the primary space, for patients and people to seek services going forward?
It
And
can be.
is it okay? And is Affinia and the kind of focus it has, is this common or is this less common across the country, if you know?
I think you probably can. We have the luxury of being able to do so much because we are a fairly qualified health center and we are boots to the ground and closer to the community, embedded, if you will, within the community. And we see firsthand. That's a plus for me to be able to see firsthand where the need lies. I think that larger health systems, they see it as well, but I think that you have to go through a little more in order to be able to trickle down into those areas. But the use of, doulas, as you stated before, community health workers, the use of those particular roles can allow you to have that access within the primary care space. So you may not be able to talk about your social determinants with your physician, but they know that if you're having food issues or that you're having transportation issues, they can refer you to someone within the office, a community health worker, for instance, and you can address those needs with them at a later time, not within your 15 minutes, of course, but if you need 2 hours to be able to work through resources that are available within your community through that person, I think that is, you have that ability then.
I think you're exactly right. I mean, once you start to understand the community you serve, you can make more of an impact there, right?
There,
And
there you go. There
yes,
you
ma'am.
go.
Yes, ma'am. Absolutely. And for me, one of the things that's kind of, just resonating with me, honestly, is the fact that, you recognize that, especially in a place like St. Louis, where there are so many issues kind of exacerbated in those marginalized communities,
Mhm.
that there is a need for a place like Affinia, where they can come in and those specialized communities those specialized populations that you were talking about, get the
Yeah.
help they need. And all too many times, I think, us as administrators, we're kind of left to use what's at our disposal, but a lot of this stuff is at a policy level. So I thank you for kind of, pointing that out as well. Um,
Absolutely. Yeah.
my last question, or last request, I guess you could say, would be,
Okay.
if you have any maybe success stories or strategies of focus moving forward that maybe will address some of those barriers, or kind of attack some of those issues, affecting those communities that we talked about.
Um, well, like I said, just kind of, looking into the policies that impact our communities and how we can advocate for change. Writing letters, making your voice heard. That is the way to do so. Just it may not impact you personally, but within the healthcare space, you see where the need lies and just kind of research, what those areas are. Again, like with the Medicaid expansion, this was not something that I had a view of previously, but here within this current space, I see it. And I can empathize, just to think as a mother that I don't have coverage, and to know that, I may not have, any complications within those first 2 months, but then on the third month I have postpartum depression. Then what? What am I supposed to do? So, again, just kind of just here listening and seeing where the need lies and being within the environment and, just making your voice heard and being an advocate.
I love that piece, the advocacy piece. I think it's something that if you don't have your eye on the policy and what's moving the needle, really
That's
you can
right.
actually become quite detached
There you
from
go.
your job, to be
Mhm.
completely honest. And
Yeah.
Takisha, I have to say, your balance as a leader comes through every single response you've given us, to be completely
Oh,
honest.
thank you.
I wanted to ask, about work-life balance. I'm like, she's got it clearly, as a
Yeah.
mother and as a
Right.
leader, as
Yeah.
someone who's in the community that's really around. And so I
Mhm.
think that, genuinely, excuse me, you are an inspiration. And
Thank you.
so what is what are some pieces of advice that you would give to folks like Brandon or myself, or even folks that are really just getting started, or what is the one thing that you would have said to, young Takisha when she was just getting her feet within healthcare?
I would have said to young Takisha, it is okay to be your authentic self.
Mm, okay.
There
Wow.
is a place and a space for you as yourself. You don't have to fit the mold of someone else. And I think things have changed a lot over the years, um, because I've realized that when you walk into a room, you are bringing value to it. So know that you are bringing value to any room that you enter, and that whatever space I leave, I hope I leave it in a better place. So, and that means being your own authentic self, knowing who you are, knowing what you are worth in every way, including financial, yes, and what you will and won't compromise on. Because if you know who you are and you know your standards, and you know you don't have to compromise on anything. Things will come to you. People will, as I mentioned, it's kind of cliche, I think, but people will mention your name in rooms that you are not in, and I've seen it happen, and I've done it myself. Because you want to, when you leave an impression, a real, true, genuine impression on people, um, what comes from the heart, it reaches the heart. And I think that you can be yourself in every situation, and know that you can excel and you can um, expand in your career, just being exactly who you are. So your unique gifts uh, will allow you to bloom where you are planted, and you will be able to fulfill your purpose. And that's only yours. That's you individually. Nobody else can give that to you. Just like I mentioned previously, you can look at someone in a role and you try to emulate that, but you can't get to that same place that they did, in that same way. They had to forge their own path, and you got to forge yours. So do it with your own personal gifts, the gifts that were given to you. So that's what I would say to myself. And that's what I would say to anyone who is aspiring, not only within healthcare, but I think just in general. That's what I give to my daughter. She's in college. And that's what I tell her to, she has locks, yes, nose ring. I'm like, yes, you can do whatever you're trying to do, just how you are. Do it. Because before, when I was growing up, you had to be a certain way. You got to wear the black or the blue suit. You have to wear your hair back, And again, with the military thing too, very structured, very, everybody's the same, but everybody's not the same, and every path isn't the same. Yeah. So, I would never foresee myself then being at this place now, being who I am, Takisha. When you see my name on the resume, you know what you're going to get, right? You don't know who I am, right? But when you see me, you're going to get a Black woman, right?
Mm.
So understand that I can walk into a room and I can add value, and I know what I'm talking about, and I'm leaving it better than I, walked into it.
Wow. That
Amen.
mic drop. Mic drop. That was excellent. Well, Takisha, we are at time. This has been a
Okay. Thank
fantastic
you.
interview. So thank you so much for
Absolutely.
giving,
Thank you for having
us some of your time and insight and just experience. If our listeners wanted to connect with you or follow your
me.
journey in any way, is there any place that they may be able to find you on social media or anything like that?
Yeah, definitely. I'm on LinkedIn. So just look my name up. I'm right there on LinkedIn.
Excellent. Well, thank you so much, Takisha.
Yeah, thank you for having me. I appreciate it. I had a great time. So.